I'm going to go ahead and call this meeting to order. It's 1:30. So I'd like to call this Health Board meeting to order. Roll call, please.
Commissioner Nolden,
Present.
Crystal Alexander, Dr. Caravala is excused, Brenda Clack is excused, Dr. Reynolds,
Present.
Stuart Sherry,
Present.
Commissioner Shoemaker,
Present.
and Commissioner Winfrey.
Here.
Great. Okay, next we have minutes from the 19th of January and the 16th. If you want, we can do both at the same time, or we can do individual. Okay, both have been moved. Do I have support?
Support.
Been moved and supported. Any discussion? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. Moving on to public comments. You'll have 2 minutes. Please state your name for the record.
My name's Tanya Prim. I'm from Richfield Township. I want the board to consider not recommending the COVID-19 vaccine for children ages 5 to 11 and 12 to 17. We don't have to do whatever the CDC recommends. We are Genesee County. We're not, and they're not in charge of the whole United States. They make recommendations. We can go against those, just like Surgeon General Latipo did in Florida. All of the data show that there's no proof that it prevents serious illness or hospitalization or death in children ages 5 to 11. That study did not have any cases of severe illness or hospitalization or death in either the placebo group or the vaccine group. That means there's no evidence besides their immunobridging evidence, which just means that children can produce antibodies at a similar rate to other age groups. But immunity isn't just antibodies. The CDC also says that 60% or more of children already have natural immunity. And so these children not only don't need the shots, but they can be put in higher danger of adverse events after the shots because of their previous infection. I recommend that everyone on the board review Surgeon General Latipo's recommendations. You can go to the Florida Health Department website and see the reasons that he gives, scientific reasons why we should not be recommending this to children that age. He says for children at high risk, it makes sense when they talk it over with their doctor, but I don't think our clinics should be giving them to kids this age at all.
Thank you for your comments. Okay, public comments twice, public comments 3 times. Moving on to new business. We have the health bills for January and February. If you like, we can move both at the same time, if you review them.
Move we pay the bills, January and February.
Do I have support? All right, moved and supported. Any discussion on them? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. Next are the positions. Now, each one of these positions, there's no county appropriations with them. I don't know how you feel about them, but if you like, we can move all of them, or we can move them individually. It's however the board will like. Go ahead.
That we recommend them as a whole.
All right, so there's a motion to move B 1 through 6.
I'm fine with that. I just want to have conversation. It's a question on one of them, so that's fine.
Okay,
Yep,
but
I'll
you
support it.
support it? Okay, any discussion? Okay, discussion, Commissioner Shoemaker, and then Commissioner Sherry.
Just the first one, we're going to eliminate a health educator and create a new health education coordination position. Is that an increase in pay or what's the
Yeah,
difference?
it's an increase in position duties as well as an increase in pay. Our Healthy Start lead funding ends June 30th of this year, and we are transitioning some of the duties of that program into our current Healthy Start program. This also is our fatherhood program position, which engages fathers in the non-Healthy Start lead program. So this will pick up some of the duties of the Healthy Start lead program that is ending, and then also continue working with our fatherhood program, which is definitely needs some work. So we're putting this up to a coordinator, but it's a slight increase in pay, yes.
Go ahead.
I just want, would you get with me on that fatherhood program
Mm-hmm.
issue one of these times? When you just when you get time, I'd just like to have a conversation with you about it, understand more about it, and see if there's any insight we could give or help, or some of the churches or something. So, thank you.
Okay. Commissioner Shoemaker, Sherry, I'm sorry.
No, that's fine. The one about the secretary, was that Sabrina? Did she move on to a different role, or what's the reason for that?
Communicable diseases.
Communicable disease and immunizations is our secretary who works with communicable disease and immunizations. So they split their time 70% to communicable disease, 30% to immunizations. That individual took the PrEP Health Navigator program or position that we put through a few months ago.
Okay.
All
Thanks.
right. Any more discussion on this? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. Next is C. It's Budget Amendment A, and we have an A and B with that. So I need a motion on it, and then we can have discussion.
Move it.
Support.
Moved and supported. Discussion. Would you like to give us just an overview? Yes.
I don't know how to read it. That was my concern too. It's just a bunch of numbers.
Okay. Would you like to give us an update on that?
Yeah, I'm opening it real quick. So the first attachment, so attachment A is reflective of each program line item, which is under the GL number. That's each program within the health department budget. Where it says description is, it's all second budget amendment because this is our second budget amendment for this fiscal year. The increase, decrease is how much that line item is going to increase. If it is not in parentheses, that means the line item is increasing. If it's in parentheses, that means that the line item is decreasing in the first attachment. Over to the side where it talks about county appropriation, the budget amendment entries and the difference, that is a note-keeping system for our financial advisors to make sure that we don't have any of our accounts or account numbers that have less money in them than we intend to spend in the new budget amendment. And then the second document, oh, that's just the memo.
And the
So
second, it's just a memo.
Yeah.
Okay, do we have any more questions?
So the bottom line is, what is the bottom line?
So with these budget amendments, what we're trying to make sure that we do is, especially with our COVID funds, we were hoping to be able to hire more help than we were able to hire. So a lot of it is moving program money, whether it's in the COVID budget, whether it's in our immunizations, family planning, sexual health, any of our programs. We have a lot of positions that either went unfilled for quite some time. For example, we have some nursing positions that have never been filled during this budget year. So most of it is moving money out of salaries to move it into something else. For example, to purchase things to be able to stand up clinics alone if we need to do that, or to be able to purchase things like refrigerators and different things that we're going to need for the new building that can be directly delivered there before the end of the fiscal year.
Go ahead.
So on the far right, there's a list of appropriations, and at the bottom, there is a difference of 278,400. I believe that's almost 92 cents.
Yes, so what that is that is our, in the state of Michigan, there's a required county appropriation from every county to their local health department. For us here in Genesee County, it's right around between 1.7, 1.8 million dollars. So that's an indication that in this budgeted projection, we're going to spend 1.5 million of that 1.7 to 1.8 million of county appropriation.
Helping a clinician.
No problem.
Okay.
So one of the things I struggle with, and I don't know if it's also what my fellow board member was getting at, is I don't have any idea what the GL account numbers are. And, I understand it's an internal tracking system. I'm familiar with it in my own place of employment, but it would be helpful to have some decoder ring or something in the future to understand what these actual budget items are. And yeah, for that specific reason, I wouldn't be voting yes today because I feel like I don't understand it well enough.
Okay. All right, any more discussion on this? Seeing none, all in favor? Aye. Any opposed?
No.
Okay, thank you. All right, moving on to contracts. Henry Ford, EPIC Community Connect. Been moved, and do I have support?
Support.
Support. Okay, would you like to discuss that? Either one.
Defer to Dr. Hackert for that.
Sure, I can help with that. So Epic is a well-known electronic health record. It is probably the most well-used in the state of Michigan, certainly, but probably in the United States as well. We had a relatively recent electronic health record system that only communicated one way. It did not allow two-way communication with the state, which meant that we were having to input a lot of things both into our own record as well as into the state record. This is a really wonderful offer that my previous employer had given me for a network cost, and then he also gave a public health discount of 8% off. So Henry Ford Connect is actually going to be less expensive, quite a bit, from our current electronic health record. We also had gotten a bid from Hurley Hospital here, which was over $1 million to set it up and over $50,000 per month. And as you can see on this attachment, the costs are dramatically different. And that also helping us more with training.
Okay, any discussion on this?
And it's two-way with the state.
And it's two ways. That's great in itself, because we'll be able to have that two-way communication. Any discussion on this? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. Moving on to laboratory consultant. Need a motion on it?
Move it.
Support.
Moved and supported. Discussion? Would you like to explain that? Oh, would you like, you have a question?
I was just going to ask, who is Tamara Thiessen? Is it just like a person? And I guess you were going to maybe explain it.
She is one of the laboratorians in Saginaw County. They have a large lab there. And she was recommended by the state community disease lab director as someone who has done this for other counties as well. So she comes in and as you can see, a temporary limited basis to go over all the test requirements that are required by the laboratory at the CDC.
We're also working through to see, obviously, there was a lab at Genesee County previously. The cost of operating and maintaining a laboratory is very expensive. When you're talking about low sample volume, sometimes it's not efficient to have your own lab, unless it's things that you can get waivers for, like beach testing and some of the testing that we do in-house, which the reagents are relatively inexpensive, and current employees that we have now are trained to do that. So part of this contract is taking time to evaluate when we move to the new building, whether the opening, operating, and maintenance of an entire lab is necessary, or whether we can partner with the state to continue sending our testing to them, and if that would be more cost-effective than running our own lab.
So this arrangement with Tammy is to look at how it's functioning on this basis. I do have the state lab director is coming to do a consultation as to what ways, looking at all of our numbers, what she thinks is the most cost-effective way, rather than starting to build a new lab from scratch if we don't need to. If we can get the state support and make sure that we have the ability to meet all their requirements as well.
Thank you.
Okay, do we have anything else? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. Thank you very much. Moving on to E, purchase exceeding $10,000. This is one, COVID-19 clinic site reimbursement. And we have that attached as, I think, 3 different sites that are going to be reimbursed. And the amount is there, so I need a motion on that.
So moved.
All right, it's been moved and supported. Any discussion?
I have a question on the amount to Shiloh. I think it might be a typo, because it's 7 clinics at $1,750, which doesn't equal $29,750.
I saw that.
Just wonder if you could clarify that.
Yeah. I saw that as well.
It should be 17, not 7.
Should be 17, you said?
Correct.
Okay.
It should be, instead of 29, it should be 17?
It was 17 clinics,
Oh, it's supposed to
not
be
seven.
17 clinics. Oh, okay. All right, so with 17 clinics, that would equal out. If you want to do the,
Yeah.
okay. Dr. Reynolds?
And to clarify, that's 17 clinic sessions.
Sessions?
Yes.
Separate days.
Separate days. Okay. Commissioner Shoemaker?
Thank you, Mr. Chair. I have a couple questions. My first is, how do we determine which churches are actually picked?
To be perfectly honest, I think this goes back to when we initially started, because all of these churches are the ones that, when we initially started doing those clinics way back when, they were one of the ones, or the three that were key. Yeah.
I understand, I just still trying to,
We initially looked at the demographics involved and where our vaccine numbers were lowest and transportation or access to the communities that were most at risk. So these places have now become kind of a known quantity, a known spot in the community, and that's why it has benefits continuing in the same places. That being said, we do an average of 6 to 9 additional clinics in different pop-up places in the community at different faith-based groups or at different at different schools, hospitals, nursing homes. Those are ongoing and they vary according to what people have asked in the communities, and also things that we have identified as a potential great opportunity. In addition to that, the state has at least 3 other faith-based clinics in the community that we are not involved with really. They work directly with the state and federal government to have those places funded for vaccines.
And just looking at the three, Shiloh, we know is in the city of Flint. Flint Central Church of Nazarene is on Bristol Road, so I think that's Burton. And then Our Lady of Guadalupe, that's on Coldwater Road, so that's Mount Morris Township, Mount Morris. So it's 3 different sections of the community where these are at. And I guess they've been,
In addition, that these were all critical places for the water distribution as well as food distribution when that was at a higher level.
okay, go ahead. Go ahead, sir.
it just, I don't know how to put it, I guess I'll just be blunt with it, because that's who I am, like a blunt hammer, is, the fact is, it just looks kind of funny. Number one, $1,750 each and $1,350 each. I can rent a lot of facility around, we could rent buildings for a year for less than some of this is costing. You know, $23,000 in Flint, most of the time will rent you a space you can have 24/7. And not that I understand some of the thought processes, there's a trust within the communities, people's churches and so on and so forth, and I understand all that, but that's a large amount of cash that's being distributed and sent out throughout our community. And I'm trying to understand, how did we come up with this number of $1,315 a day or $1,750 each time for another one? That just, nowhere else but government pays that type of money to use a space. No, if I had a kids program, let me give you the same example. If I was to say I want to run youth basketball camp out of one of these church gyms, are they going to charge me $1,350? No, I'd never be able to pay it. No one will pay it. But because it's government, we're being hammered. And I'm sorry, I think it's sickening. I think it's shameful. And I'm sorry, if it was my church taking that kind of money from somebody, I'd actually look at my pastor and go, whoa, because would you charge the same little faith-based group of kids that want to play basketball the same money? Would you do that with somebody who wanted to have a AAU meet or a Alcoholics Anonymous meeting? Would you charge them the same money? That's not that same money, but because it's government, guess what? That tally comes in and boom, guess what? The American taxpayer pays it. And I'm just,
So I would defer on some of those points. One, these people all volunteered. They were not expecting to get paid at all.
I'm not saying it's their fault.
just saying.
If you're giving me it, I'd take it too.
So it was the state who directed us to pay those vaccine sites that we were distributing it to it. We originally, as you recall, had DORT site set up, and that is where we got our third-party, no connections at all cost. And then when we reduced the number of hours, we reduced the cost difference is they also stand up a lot of volunteers there. And so it's not just the actual space. So we couldn't take this type of facility or this kind of action and take it to a vacant storefront and have the same kind of response. Because we would have to do more of the work.
Well, at 18 days times $23,000, these aren't, most of these people working at these clinics, when the ones I've been to, there's a few registered nurses that volunteer, but most of the time it's just the regular parishioners of the church. And they're not going to be making, if they go anyplace else, any more than even, let's say, $15 an hour. It's just, it's been done, but the fact is it just looks bad. I'm sorry, it really does. And that one church is getting more than another, that looks bad. But the fact is, nowhere else but government does this go on. And that's my frustration. I don't care what the state says, because I'm sorry, I've been in these meetings a long time, and I ask Kayla every month, how's the state doing for help, or have they given you help, they giving you guidance, and you know what she tells me every time? It's right on tape, no. So I don't trust anything the state says as far as this whole pandemic. And my frustration is that's a ton of money for certain churches to get. And what about the other churches? Because I would tell you, some of these churches don't take that in and tithing a month. So it just looks suspicious. I'm going to vote no on it because guess what? Not that I don't think we need to be in these communities, but I think we could do a better job with it, and I think we could be fairer and more transparent with it. So I thank you, Mr. Chair. I thank you to the health officer.
The difference in the price is because of the hours.
Thank you.
And we have to pay the heating too and the cleanup of those facilities. So, all right, any other questions or concerns on this? Seeing none, all in favor?
Aye.
Aye. Any opposed?
Nay.
No.
Motion passes. Next, we're moving on finally to F, the proposed changes to the bylaws. So I need a motion on that. All right, moved by Dr. Reynolds,
Support.
supported by Commissioner Winfrey. Do we have any discussion? Yes, sir.
So the question I would have is, there's 4 paragraphs in the attachment, which I think is maybe the 3 preceding paragraphs are the explanation of why the changes. And I just wanted to confirm what actually will be the language that is going to be in the bylaws. Is it all 4 of these paragraphs?
Go ahead.
I hope it will be, because the Board of Health membership will not be the same all the time, and this will be an explanation to new board members like you and I why things have changed.
Understood, and I don't have a problem with that. I guess the thing that reads kind of weird to me then is if you read through the first 3 whereases, then the statement in Article 4, Section 2E will then say, therefore, Article 4, Section 2E should be amended to require blah, 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 blah. That doesn't, it doesn't sound like what should be in there. I think what you're trying to get at is what it should say is the GCHD should participate fully and completely with the review authorized under the Michigan Local Public Health Accreditation Board, and so on and so on. So I just wonder how that's going to look when we put it in the bylaws the way it's stated.
I don't write bylaws, so I couldn't tell you.
I understand. And I don't know exactly either, like how, I know if we approve it, then it has to go to the Genesee County Board of Commissioners for final authorization. I don't know if we get like a corporate council feedback or anything like that.
I would definitely do that. And we will forward it to Corporation Council, and then any verbiage that needs to be changed that keeps the gist of it would be it. So I think if we just move this to the full board, then we can actually take that up.
Then we'll
with-
make sure corporate council.
Absolutely.
Sounds good.
Absolutely. Okay, any more discussion on this? Seeing none, all in favor?
Aye.
Aye. Any opposed? Motion carries. Under communication, report for communicable diseases for January and February. I know we had a brief discussion on that last month, even though we didn't have a quorum. So I don't know if we want to go back through that or if there's any questions or concerns.
They just wanted to cover February, I'd be fine,
February?
Mr. Chair.
Okay.
If they would, because
Yeah.
January we did kind of cover.
Yeah, we
last
did.
meeting.
Right now, we are not seeing any disease levels, obviously, COVID aside, in terms of anything above what we would expect to see this time of year. Moving into the spring is typically when we start to see increases in foodborne illness due to outdoor picnics and people leaving egg salad out way too long when it gets too hot. It's true. So we expect to see that in the coming months, right in January and February, obviously with very little data to the beginning of the year. Usually we don't detect much in January and February. It starts to be in March, April. If something is going to come up, we usually start to detect it around then just because temperatures get warmer. You have more people outside doing more things. When swimming picks up, that's when you start to see the Giardia and the Campylobacter and the type of things that you see with Michigan summer type of activities. Of note, this is not in the communicable disease report, but it's been in the news about the highly pathogenic avian influenza that was found in a backyard flock of poultry over in Kalamazoo County. The state health department is conducting an investigation out in Kalamazoo County right now. They've tested some flocks that surround that flock in that same area. They have not found this avian influenza in any of the flocks that are in close proximity in that area to this flock. No word yet on where the avian influenza might have come from. They also have not detected in any human beings, but as we know, as we've seen with other flu outbreaks, that's absolutely possible for it to jump from birds to humans. We've seen that before. So the state health department is keeping a close eye on that. They have not opened their emergency operations center yet. I suspect if there's any evidence of spread of this, they would likely activate their emergency operations center in response. However, that has not been done at this time. In terms of evaluation of risk level for other areas in Michigan, obviously is very low right now as we don't know of any spread, but if that changes, we would obviously update the public with that information.
All right, any questions or concerns?
I want to be concerned,
Commissioner
just have
Shoemaker.
one quick question. As far as the flu this season, I've noticed there's not really still the numbers on there that we used to have. Do you think we're going to see an uptick in the flu next season then?
I would expect we would, yes. The last, since COVID has appeared, the flu seasons have been relatively abnormal just because we didn't have as much international travel. Usually the flu season starts in the southern hemisphere and then makes its way up to the northern hemisphere. And due to lack of travel, we didn't really see that the last few flu seasons. So I suspect that in the 2022, 2023 flu season that we're going to see much more of a normal flu season is what we've become accustomed to.
I think the testing of the flu will be as common as it is for COVID ever. Because I'm going to tell you, the testing for flu before was, if you had the flu, it was, hey, you have the flu and they let you go, and people were still dying from it at numbers that we still don't really want to have an honest discussion about the fact of how many people the flu was taking care or killing. So I just wondered if you think they'll be actually testing, or if we as a county are planning on actually to create a greater sense of health in our community, focusing on testing for flu like we do for COVID.
Yeah, I think a lot of it depends on physician, and Dr. Reynolds or Dr. Hackert might be able to comment on this better, but a lot of the standing orders for Tamiflu prescriptions it used to be that you needed to test somebody for flu in order to prescribe Tamiflu. Obviously, in high volume flu years, that's not really plausible. So a lot of it depends on what the standing orders and recommendations for specific patients are of, this sounds like the flu, I'm going to provide you Tamiflu, therefore I'm not going to test you for it, or if you're coming in for a visit to be tested. So a lot of that depends on what the prescribing practices are for non-hospitalized patients.
Additionally, the tests are in existence and will be in greater use next year. Are you doing one swab that will test for both flu and COVID at the same time?
Okay.
And there's always what they call the sentinel sites that are scattered throughout the state where they're monitoring positive flu tests, the state health department. So it is an ongoing process, and like Dr. Hackert said, now that we have the capacity, it may be done more.
I would hope so, because if you've been on this board long enough, before COVID, we would see the flu numbers.
yeah.
If you've talked to anybody in ICU that from years past, they will tell you the flu is very, very dangerous, especially to our elderly population, people who are at danger with COVID of having some issues. So I just wondered, because we made such a big deal out of this, and the fact that we're continue with this, and make sure if we are really focused on community health, we're gonna take care of the flu as well as COVID, and look at it the same, because it does, the flu does kill people. It's very dangerous, and if we're gonna be consistent with one, I'm just wondering if the state's giving you any guidelines as far as what they're gonna see with that since then, or?
We haven't gotten any guidelines from the state, but our flu program is one of the reasons that we have so many seasonal nurse positions. We go out into the community and we provide the opportunity for people to get flu vaccinations, to provide education about influenza. So we do intend to continue to do that. And also try and, obviously, with the supplies and things that we've acquired through COVID, we should be able to do actually more outreach when it comes to influenza vaccines, as well as making sure that we're catching up children on routine pediatric immunizations, since those have lagged behind with the medical closures that occurred in 2020.
Thank you.
Okay, anything else? Seeing none, we have any other business?
I have a couple of questions, comments, if I can.
What?
Maybe some simple ones, as I had mentioned back in January when I started looking at this review, we talked about that our website still has our old health officer on there. It still does as of today. I just would really suggest we at least remove the name or change the wording or something. It's in the About Us section. The other thing was, I noticed, and I remember when I did a tour of the health department over a year ago, we spend a lot of money with Healthy Start with the lead situation. I would be interested if we can get a time on the agenda in the next few months to have I think it's Tamara, is that right, in charge of it? Maybe give us all in the community an update. What do we do with all that money? I know it's a very beneficial program and it's something that's important, but I think it could be helpful for people to understand really what's going on there. So just one suggestion. The other thing was, I don't recall, did we decide if we're going to do 1 or 2 meetings at night? Because I thought the Board of Commissioners was going to, is it next month? And if they were, we had said maybe we would do the same thing. And I just wasn't sure if that was something we should discuss
Well,
today.
I had that statement at one of the meetings because of some of the comments that were made, and I was thinking about it, and then, I went back and I prayed on it. We are going to have 1 or 2.
Okay,
So I'm thinking I think we're doing one in April for the Board of Commissioners. So I'm thinking about maybe doing one in April for the Health Board, and then, then maybe do one maybe late summer.
Okay.
Early fall. But yeah, we are gonna do a couple.
that's great.
Our commissioner meetings that are at night, we have 2, one's in April 6th and the other one's in August. I think it's August 19th, if I'm, something like that.
Yeah, so let's do this. Let's do the 3rd Wednesday in April. What day is
Yes,
that?
since we already have the agenda set, if we don't want to have to post all the stuff, you need to have somebody make a motion, and then if you
Okay.
guys vote to do it, we can change it
Can
on
we
the
have a
website.
motion that we have a night meeting for the April meeting, and we'll set that is it 5 o'clock?
I will move that motion.
Okay, it's been
Second.
moved and supported to have our next month meeting at 5 o'clock in the evening, so the residents will be able to come to the Health Board meeting,
April 20th.
April 20th. It's been moved and supported. Any discussion? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. So we're good with that, and then
Do you want
we'll,
to just vote on August then, too?
is it August or is it
August would
I think
be,
it's August.
August?
Almost.
All right,
August would
so
be the
let's
17th.
also do August 17th at 5 o'clock.
hold on, though, what time? Board of Commissioners is at 6, though, right?
Oh,
On the 17th.
If,
is that a Wednesday?
Yeah, it is.
And it's what
So this is the night meeting for Board of Commissioners, and then this is the other night meeting for Board of Commissioners. So we would we could do 5 if you think we'll be out in an hour, but I don't want to stall Board of Commissioners. So should we do September, maybe?
you know what, let's do this. Let's do September so we don't impede on the one in August.
That'd be
So
the 21st.
we'll do the Wednesday in September, 3rd Wednesday.
21st.
And that'll be at 5 o'clock as well. So it'll be the 21st of September. So can we get a motion on that?
So moved.
Okay, moved and supported. Any discussion?
God
Yes.
forbid there be any surge we will follow the protocol.
Yes, we will.
directed. Thank you.
We will. All right, and seeing no discussion, all in favor?
Aye.
Any opposed? Motion carries. Okay, so now, I don't think we have any,
I wasn't done. I had a
Okay.
couple other,
Okay.
one other maybe quick one and then a little bit more of a discussion. So I know that we currently, I think, are a board of 9, if I recall correctly. And I know last month we weren't able to achieve a quorum. And I don't even know if this is really appropriate to ask, but I'll ask the question to the chair. To make sure that we stay effective, do we have any communication with our board members that are regularly not attending? If this is something they want to continue supporting or not?
we have had some conversations with them. Dr. Carvella, she is in Florida, so that's why she's not here. I've talked with Brenda Clack, and we're continually, having some discussions with her. So we're going to see exactly where we're at. But yeah, we have had conversations with the ones that are not attending, and we're going to get to it.
Okay, and I want to be very clear, I'm not trying to pick on people, but I think it's important that,
be here.
the minimum is we attend when we can and, do more when possible.
Absolutely.
Okay, so my last comment was I wanted to talk a little bit about some discussion we had last time around COVID, and I will try and make this relatively quick. I think there was a very good analogy brought up about, we're in a pandemic still, and it's kind of like being in a burning building where everything else is secondary. And I really do understand that line of thinking, because if you think about firefighters, I mean, that's what they do, right? They knock down the building, they destroy personal property, they put the fire out. The thing I struggle with is I think that what's lost on that analogy is it's a bit like if the firefighters said there's this abandoned building over in the corner and it's smoldering and there's a line of people standing in the way and we're going to run them over with the fire truck to put this burning or smoldering building out. That's the way I would say I feel about COVID, especially today. It's not to the point where people are dying left and right. You go outside, I mean, life is getting back to normal. And my opinion would be it should have been like that a long time ago, and I understand we can have differences of opinion, but I just think that that analogy lacks the thought about what are the other consequences, which we all, I think, know at this point. I mean, it can't be argued that kids' mental health has been destroyed in many cases, and, I mean, we heard about that individual last time, and I mean, I'm not a doctor. I don't know what hypoxic-induced brain injury is, or if that's even really a thing. And I would trust people in the industry that understand that. But this like totalitarian implementation of masks that schools did based on recommendations and kind of felt bullied into, I think was really a terrible thing for our community. And this is why I just want to remind people, and I will do it forever probably, that COVID's not the only thing that matters. And lifelong impacts to children who are at the lowest risk from any disease from this, and their mental health is, I mean, things we're going to be living with for decades. That's it.
All right, thank you very much. Anything else? Seeing none, we stand adjourned.